Hey everyone, so I'm just going to jump right into the case study. For Isaiah Hill, I would diagnose the F43.10 ICD, which is post-traumatic stress disorder. Isaiah Hill is a 43-year-old black man who was referred by his spouse concerning his behavior since being released 7 months ago from Wynn Correctional Facility. During the interview, Isaiah shared that he had been sexually assaulted while at this facility and has not told anybody about the experience, including his spouse. Isaiah explained that since being released, he had been experiencing intrusive and persistent negative thoughts, trouble sleeping, anxiety, fear, a short temper, and avoidance of situations and people that remind him of his trauma. While in Wynn Correctional Facility, Isaiah experienced a traumatic event of sexual assault, specifically rape. He experiences recurrent and intrusive distressing memories of the event, intense psychological distress, which include anger and anxiety, at external cues that remind him of the event, and particularly when he sees a man, and physiological reaction of feeling sick, also when seeing men. Isaiah avoids stimuli that is associated with this trauma by avoiding external reminders that arouse distressing memories. So being in a situation with a potentially higher amount of men, he avoids it at all costs. He experiences negative alterations in cognitions and mood associated with the traumatic event, which worsened after it occurred. These include persistent negative beliefs about himself. He may not see himself as what he classifies as a real man. Self-blame is evident. He couldn't protect himself. And what kind of man lets this happen? Persistent negative emotional state of shame, fear, and anger. Detachment from his wife and other people, and the persistent inability to experience positive emotions such as happiness or satisfaction. Marked alterations in arousal and reactivity is evident, as described by irritable behavior. His wife explains that everything causes an argument, hypervigilance of situations, problems with concentration, and sleep disturbances. The duration of the disturbance has lasted for 7 months following his release and the event. It does cause him significant clinical distress and impairment in social functioning, and as well as occupational functioning. He has trouble reintegrating into society after he was released. And Isaiah's disturbance is not attributable to the effects of substance medication or medical condition. So his objectives of treatment would include him working to reduce his distressing symptoms such as negative cognition and self-blame. The second objective he will increase his functioning within social and occupational settings. Objective 3, Isaiah will increase his coping skills when faced with triggers, intrusive thoughts, and negative external cues. And the last is when he's ready to share his experience with his wife and allow her to help him through this experience. The assessment, so before the treatment can begin, he'll need to complete a clinical interview. And this will give the clinician a lot of information, specifically about his background and just more about the event and how he's, experiencing the effects of it. And then a clinician-administered PTSD scale, and it asks how often he has PTSD symptoms and how intense they are. And then another assessment that we could implement is the PTSD checklist, which is self-report questionnaire, and it just asks about how often he experiences the PTSD symptoms over a period of time and how they might have changed. So while treating Isaiah. The clinician needs to play an active role in the treatment, but also having just positive regard, empathy, warmth, and they must not, they shouldn't push the client to share anything that they're not ready to. A therapeutic and collaborative relationship is vital in this context because it's on the basis of building trust, because the client may lack trust. So the location of his treatment, it'll be an outpatient setting in the counselor's clinic. An inpatient facility wouldn't be required because he doesn't report any suicidal or homicidal ideations. And also a referred psychiatrist to manage medications if he were to be prescribed any. And also he has a medical history of hypertension, so he would need to also go to his primary physician's care office. So interventions that could be used: cognitive processing therapy, is specifically developed for sexual assault survivors, and it is all based on cognitive restructuring and trying to address those maladaptations. Intervention 2 is the prolonged exposure therapy, and this has been the most effective therapy for PTSD. The client creates a fear hierarchy, and along with the counselor, they're exposed to it step by step, and eventually he'll learn to face it head on, his fears. And another intervention, anxiety management therapy, it will just help him decrease his anxiety and cope better with triggering events. So Isaiah will definitely need a high level of support from each of his care team members and spouse, and it'll be cognitive and emotional focused due to his level of distress that the trauma's caused and just increasing his functions in social and occupational settings. And he will participate in individual therapy and referred psychiatrist. And it's recommended that his wife and him engage in couples counseling so that she can increase her knowledge on PTSD, understand the event that happened to him, and it also could just help rekindle their intimacy because there's a lack of, and reconnecting moving forward. So Isaiah should ideally receive counseling weekly. And then as treatment progresses, it can be discussed whether the sessions can be reduced or increased. He would need to see his PCP once a month and a psychiatrist like every 4 weeks, and couples counseling every 2 weeks. No medication has been prescribed for him, but SSRIs and would probably be very beneficial for him, and that could include Paxil and Zoloft, which will just, again, decrease some anxiety and help him with the more depressive sides. Isaiah did express that he was having a hard time reintegrating into the workforce, so potentially engaging in vocational programs that are targeted towards previously incarcerated individuals might be beneficial for him. And through the right treatments and the commitment to the treatment, Isaiah should see a reduce in his symptoms, or it could take a long time for his symptoms to completely dissolve. So he could be a differential diagnosis, or 2 of them, as other post-traumatic disorders and conditions and adjustment disorder. They're both similar to PTSD, but the criteria, Isaiah makes the criteria for PTSD and not those. Cognitive theory would be used to address his thoughts and those processes, and then cultural considerations. It's important to remember how he identifies himself, so what his beliefs are and everything. And he identifies as a Black man, and it's important to remember that racial and ethnic discrimination may influence the severity and onset of PTSD. And some cultures influence how certain symptoms are expressed. and how they might perceive the trauma. So through more just talking and getting to know Isaiah, we would learn more about that too.